Hi guys, welcome back to the channel after the weekend. So we have finished with systemic disease affecting bone. We'll be continuing with the fibro osseous lesion. We'll be starting cemento osseous dysplasia and its type. Okay, let's start. Cemento osseous dysplasia. It encompasses a spectrum of dysmorphic bone and cementum phenomena. Dysmorphic bone or cementum causes cemento osseous dysplasia. Three types: periapical cemento osseous dysplasia, florid cemento osseous dysplasia, and focal cemento osseous dysplasia. In periapical cemento osseous dysplasia, it is localized form found in anterior mandible. The periapical cemento osseous dysplasia is a localized form found in anterior mandible. Then florid cemento osseous dysplasia is the widespread form of dysplasia, and the focal cemento osseous dysplasia is a localized form found in single area other than anterior mandible. Okay, it is a localized form found in anterior mandible. It is also a localized form, but it is found in single area other than anterior mandible. This is the difference between periapical and focal. And florid तो widespread है. So these are three types of cemento osseous dysplasia. We'll be dealing this in details. Okay. Now, the pathogenesis of cemento osseous dysplasia involves mesenchymal stem cells that seem to have lost their structural morphology and therefore produce dysplastic bone. तो mesenchymal स्टेम सेल्स हैं जो अपना स्ट्रक्चर मॉर्फोलॉजी खो चुके हैं, इसलिए वो डिस्प्लास्टिक बोन बना रहे हैं. सो दिस इज़ द पैथोजेनेसिस फॉर सीमेंटो ऑसियस डिस्प्लेसिया. So these kind of cells, जो mesenchymal cells which have lost their structure morphology, so these cells produce morphologically imperfect bone or cementum. Morphologically ये bone या cementum जो भी बन रहा है वो imperfect है. So this is called dysmorphic bone. Okay. Now coming to periapical cemento osseous dysplasia. Clinical presentation. It refers to an asymptomatic set of lesion that forms around the apex of mostly mandibular vital anterior teeth. Four things: asymptomatic, apex of mandibular, third is vital, and fourth is anterior teeth. So periapical cemento osseous dysplasia refers to an asymptomatic set of lesion that forms around the apex of mostly mandibular, vital anterior teeth. Undergo an evolution from radiolucent to mixed radiolucent radiopaque to completely radiopaque without a change in root structure or tooth vitality. जो रेडियोग्राफिक फीचर है, जब स्टार्टिंग में होगा तो वो रेडियोलूसेंट होगा, उसके बाद मिक्स रेडियोलूसेंट रेडियोपेक होगा, और लास्टली स्टेज में जब हो जाएगा तो इट बिकम्स टोटली रेडियोपेक विदाउट अ चेंज इन रूट स्ट्रक्चर और टूथ वाइटलिटी. ओके. वुमेन में ज़्यादा कॉमन होते हैं, मोर कॉमनली फाउंड इन वुमेन अराउंड द एज ऑफ 40 years and most common in African population. So this cemento osseous dysplasia, either it can be periapical, florid or focal. These are more common in women and in African population around the age of 40 years. This is common. Okay. Rarely in anterior maxilla. Sometimes it can occur in anterior maxilla, but most of the time it is in anterior mandibular vital teeth around the apex. Okay. It is an incidental radiographic findings because these lesions do not induce tooth mobility or bony expansion. Incidental इसलिए है क्योंकि क्लिनिकली ना तो टूथ मोबिलिटी है ना बोनी एक्सपेंशन है, तो पता कैसे चलेगा. तो हम लोग किसी और चीज़ के लिए रेडियोग्राफ ले रहे थे, लेकिन हमको ये दिख गया. सो इट इज़ एन इंसिडेंटल रेडियोग्राफिक फाइंडिंग because these lesions do not induce tooth mobility or bony expansion. Okay, that's all for today's class. We'll be continuing this topic in the next class. Till then, like, share, subscribe and comment. Bye.